Hi, amazing parents. I wanted to show you a super simple movement that you can try at home with your child if they have any type of spasticity in the hand or the arm. This is a gentle brain-based movement to help your child's brain get the right information it needs to reorganize its movement, to reorganize and reduce the spasticity. Now, when we see spasticity in the hand or the arm, often it looks something like this. Of course, there's lots of different variations. So your child's hand or arm might look a little bit different, but the same principles apply. Now, most people will try and do stretching exercises to the fingers and the hand here when they see this type of spasticity. So I just want to pause for a second and expand the awareness of what exactly is going on in the hands and the fingers here. And you can follow along on yourself. Actually put your arm and hand in this position here. And you'll see to get your hand and fingers in this position here, there's a rotation in these bones here that have to rotate inwards. So there's not just spasticity in the hand and the wrist here, but there's also spasticity in the rotation of the forearm, the two bones right here. And there's also muscle contraction in the shoulder that slides the shoulder blade forward and rotates us in. And that's where this movement here that I'm going to show you will help. You're going to help your child's brain explore a different movement of the shoulder blade that will help the movement of the forearm, that will help the movement of the wrist and the fingers. So most stretching and exercises is starting from the fingers downwards, and this gentle movement works from the opposite way. So we're going to explore how much movement can we get in the shoulder blade first that is going to naturally overflow and help the brain reorganize these muscles here. So when we can help the brain reorganize and get more movement in the shoulder blade muscles, it will also help the brain reorganize these forearm muscles and the wrist muscles and the finger muscles. Remember, our body parts don't move in isolation, we're connected. So let's give this movement a try. In this position here, you can slide your hands underneath your child's shoulder blades, both of them here. I'll turn Sven over and I'll show you where my fingers are connected. So the soft pads of my fingers are connected to this triangular shoulder blade bone right here. So I'm connecting right there with both hands. Both fingers, my fingertips are connected with that triangular shaped shoulder blade. They're lying on the floor like that. And now very slowly and very gently, don't go too far or too fast. Remember, it's more important to give your child's brain quality information, not quantity of information. So keep your movements slow and gentle so their brains can make sense out of the information. So with your fingers gently connected to their shoulder blade bone, do a movement of the right hand sliding a little bit down towards their feet and your left hand sliding up towards their head. And then the left hand sliding down towards their feet and your right hand sliding a little bit more up towards their head. Now you keep the backs of your hands on the floor below them, sliding the right hand down towards their feet, the left hand a little bit up. Left hand down, right hand up towards their head. So you're switching back and forth like a little seesaw, sliding your hands on the floor. So my hands look like this. They're just sliding the backs of my hands on the floor and their shoulder blades are nestled on my fingertips here. And I'm just sliding one shoulder blade a little bit upwards towards the head and one shoulder blade down towards the feet. Then the opposite shoulder blade down towards the feet, the other one towards the head in this gentle seesaw type motion. And what you'll start to see is the ribs in front and the clavicles, the collarbones here, start to slide with the movement as well. And you can try this on yourself just in a sitting position. It's the same movement. So as I slide one shoulder blade up towards the head, I'm going to slide my other one down towards my feet and then the opposite. So this is the movement that you're trying to recreate with your child, just having them lying down on the floor. And what it looks like in the front, one shoulder blade's going up, one's down, one shoulder blade's going up and down. And I'm wearing the right shirt. You can see my collarbones and even my ribs are sliding with the movement of the shoulder blades gliding as well, because the shoulder blades are connected to the ribs, are connected to the collarbones, are connected to the arms, are connected to the wrists and the hands and the fingers. And so when there's more freedom of movement in the shoulder blades, there's going to be more freedom of movement in the upper arm, and the lower arm and the wrist and the fingers and the hands. So give this gentle movement a try and let me know how it goes down below. What changes do you notice with your child? Maybe a little bit of a loosening up of the fingers, maybe a little bit more movement, maybe they're reaching up a little bit higher, maybe they're just more comfortable and have less pain. And if you want more movements to help reduce spasticity in the arm and the hand, go watch this next video here.